Hi, my name is Dana Wentzel, and today I'm going to be speaking about physician-assisted suicides and should it be legalized in all states. Sorry, there is nothing more that we can do for you. Those were the words from a physician that nobody wants to hear. Can you imagine you're in chronic pain, terminally ill, and your loved ones are helping you with your everyday needs, such as bathing you and feeding you? This leads people to seek for physician-assisted suicides. Today I would like to talk to you about what is physician-assisted suicides and should it be legal. By sharing this information, I would like to convince people that there are other options such as hospice. So a little history of physician-assisted suicides. The controversial issue of assisted suicides in healthcare dates back as early as the 5th century BC in ancient Greece and Rome. According to Greece and Rome, physicians vowed under an oath prohibiting doctors from giving a deadly drug to anybody. Unfortunately, many physicians performed involuntary and voluntary killings. They often gave the patients a poisonous drug to assist with death, and the poisonous drugs was hemlock. Many factors in interrelationships associated with assisted suicide are controversial, emotional, and moral issues. And of course, based on Christian doctrine, suicide is not an acceptable choice. The major factors propose conflict between the patient's right for autonomy and the professional health care's, their ethical duty. Many people are confused with the terminology between physician-assisted suicide and euthanasia. The term physician-assisted suicide and euthanasia are different. Physician-assisted suicide is when a physician provides the means to carry out the actions, and euthanization is the intent to cause the death of a person, the motive being benefit the person from suffering. What we do for there are active and passive euthanasia. And the active is euthanasia is when we give them and we directly put the medication into the bloodstream to intend to cause death. And passive is basically if a person is having problems breathing and they require oxygen, we do not give them the oxygen and then in general let nature's take its course. And that's the difference. So I would like to, the major factors, like I said, propose conflict between the patient's right. Is this right for them? Is it how as a healthcare profession do you set your personal beliefs away, put them aside to help with the patient's decision? So I would like to talk about, there is one state in 1997, Oregon, that developed a law called Oregon's Death with Dignity Law. This allows the residents of Oregon who are terminally ill to end their lives voluntarily. A physician will prescribe a lethal dose of drugs to the terminal ill patient. The terminally ill patient self-administer the prescribed drug to end his or her life at home, not in the facility where the doctor treats other patients. By the DWDA, decided to collect data, and under one study in the collection in February of 2012, prescriptions for lethal drugs were given to 114 terminally ill patients. Of those 114 terminally ill patients, 64 of them ingested the medication, 63 died, and one of them, out of this 64 that adjusted the medication, lost the consciousness but regained it before dying and died 38 hours after adjusting. And because of that, the DWDA did not include that as a physician-assisted suicide. 25 of the 114 patients received the prescription drug, decided against it, and died of the underlying disease itself. So assisted suicide presents a dilemma for the healthcare profession. And I would like to share, I do not support this position of assisted suicide. Assisted suicide, excuse me, does not have to be the only option. And there are is palliative care. Unfortunately, decline in quality of healthcare if assisted suicide is legalized, the HMO will, if they make this legal, I believe that this would be a decline in our healthcare system. And by that, and I understand the patients have the right for autonomy, but the general population should separate their personal issues and further investigate the dangers of legalizing assisted suicide. For example, assisted suicide and HMO, which is managed care together, would be a deadly combination. Managed care companies have overruled many physicians' decisions and caused many healthy patients' death, let alone if this was a terminally ill patient. The cost of lethal medication is estimated to be $35 to $50 to purchase. This option is way less expensive than palliative care or long-term treatment for the patient. And because of that, many of the insurance companies care about one thing, and that is cost effective. So what would be the cost effective thing to do? Well, according to Saul Macy, his assisted suicide is likely to, he believes that, and he did a study at Georgetown University Center for Clinical Bioethics. They did a profit-driven managed healthcare and assisted suicide. The research found a strong link between the cost-cutting pressures on physicians and their willingness to prescribe the lethal drugs to patients where it is legal to do so. The study warns that there must be a strong, sobering degree of caution in legalizing assisted suicide. In medical care environment, that is characterizing by increasing pressure on physicians to control the cost of care. And with that, the deadly impact of legalizing assisted suicide would fall harder on socially and economically disadvantaged people who have less to for medical resources. And that is why today I wanted to share these few studies with you, because I believe hospice, there are other alternatives such as hospice. Hospice believes not treating the diagnosis, but treating the patient as a whole, emotional, spiritual level. It's a holistic approach. And they want to make the patient feel comfortable. And they want to give patients options to empower them, to allow them to make the decisions in their care, and to help see the loved ones in a non-hospital setting. And by this, I think the hospice will embark on therapeutic skills. And like I said, I believe that there's other ways than assisted physician suicides. Thank you.